In the pharmaceutical and health world, there's a category of education called unbranded patient education. It's where you're really trying to help people who have chronic conditions better understand their disease, better understand the treatment options, and understand how to talk to their doctor about it.
There's a recipe that we have proven is working on Merck Consumer Health, and the 3 ingredients to the recipe are inspire them to become their best selves and to become part of a greater movement, communication with emotions, which is very, very important. You can have the best product out there unless you know how to communicate to me. And the third aspect that is near and dear to my heart is love at first sight. People have a smaller, shorter attention span, and those few seconds in the first experience, either you look very attractive to get matched with the healthcare professional, or you lose out the game.
When you want to try to reach out to these folks, there's a few kind of rules of thumb to follow. Like number 1 is it's good to go where they are. Number 2, start by listening to truly understand what these folks care about.
The journey is really important. What message are we going to deliver right at the start of their journey? We are going from very little data to a lot of data, so we have to be empathetic in terms of where we actually share these key messages. And the way we look at it is we want to build a content strategy that's a net of support that drives the best possible outcomes to help us with this journey.
And what we're talking about here is how do you engage communities to make healthier choices. We have to invest in the community overall. We have to invest in the kinds of community infrastructure that helps to build up the community, helps to build up the family, and then build up individuals. And so understanding that health and healthcare is a local endeavor, and the best and most creative things we can do is empower local communities to make the right choices to improve their own health.